Assignment 1, First Aid for Sports Injuries. In this assignment, I will be discussing what first aid should be given and what procedures should be taken for 4 different injuries. The injuries I have chosen to discuss are fractures, dislocations, cramp and abrasions. Here I have a combination of hard tissue and soft tissue injuries. Fractures. This type of injury is a hard tissue injury and is a break to a bone due to a traumatic incident where the bones become cracked or splintered. There are different categories of fractures. An open or compound fracture is where the bone has been broken or punctured the skin, and there are closed and simple fractures. The different fractures include a hairline fracture. This is a partial break and normally only affect a small part of the bone. This type of fracture can be difficult to identify. A compression fracture, which is most common down the spine because it is a complete break of the bone, and a stress fracture brought about by repeated actions which cause an increase of pressure on the bone. This fracture mostly occurs in athletes such as long-distance runners. Fractures are the most common in contact sports such as rugby and football, and they occur in the wrists, collarbones, and in the ankles or feet. Some symptoms of fractures include swelling, redness, and pain. Most fractures are extremely painful, especially when the more complex fractures break the skin. Complex fractures are clearly visible and can be diagnosed straight away. Therefore, precautions can be taken quickly. Depending on the severity of the injury, there can be restricted movement on the injured area for a long period of time. When treating a fracture, it can depend on the type of fracture, and the most important form of treatment should be recognised. First of all, it is important to assess the situation and find out how the fracture happened, either from the injured person or a witness. Secondly, you need to identify the location of the injury and ask them to describe where the pain is. If the fracture is an open fracture, it shouldn't be touched, as this could increase the risk of infection. When treating a fracture, it is important not to use active and passive movement, as there would be limited or no movement at all. It would also cause the person a lot of pain. Initially, when the fracture has been identified, it is important to immobilise the fracture, which will reduce pain and the risk of further injury. Ice would then be applied to the affected area. This will help reduce the swelling because it reduces the blood flow. It only should be used on a closed fracture. Pain relief would also be given to reduce the pain and to further reduce the swelling. It is advised that a fracture is x-rayed by the A&E department. If a fracture was confirmed, it will most likely have a plaster cast fitted. Wearing a sling or using crutches to allow the bone time to heal. If the fracture is more serious, it may require realignment. This may involve pins, wires, or nails. Once the healing process is nearly complete, physiotherapy is recommended to strengthen and improve flexibility and movement. Stress fractures require a long period of time to heal. The next injury is dislocations. This type of injury is to a joint, a place where 2 bones come together. It occurs when a bone slips out of a joint because it has been forced from their normal positions. This type of injury is very painful and temporarily deforms and immobilises the joint. Dislocations are most common in shoulders, fingers, elbows, knees, and hips. When the bone becomes out of place, it is important to seek medical attention to put the bone back in its place. Dislocations mainly occur in contact sports such as hockey and football, and in sports where falls are common such as gymnastics and skiing. Sports such as basketball often see dislocations to the fingers because of the power of the ball striking. Some symptoms of dislocations are visibly deformed or out of place, swollen or discoloured, and immovable, and often cause severe pain. The type of treatment used for dislocations depends on the site and the severity of the injury. First of all, it is important to assess the situation and find out how the dislocation happened, either from the injured person or a witness. Secondly, it is important to locate the injury, whether it be on the shoulder, hip, and get them to describe where the pain is. It is important not to use passive movement on a dislocation because it could worsen the dislocation and there would be limited or no movement. However, active movements could be used in some severities. For example, seeing if the injured person can wiggle or move their fingers and toes to make sure no major internal injuries have been suffered. When first identifying the injury, it is important to immobilise the injury until you seek medical attention to try and reduce the pain and any further risk of injury. Ice can be applied on the area around the joint to help ease the swelling and pain. It is also important to take pain relief so it's easier for doctors to realign your bones when you get to hospital. At hospital, an X-ray of the joint will be used to confirm the dislocation, and this may reveal any other injuries. The doctor may try gentle movements to help your bones back into position. After the bones are back in position, it will be immobilised with a splint or sling for several weeks. This all depends on the severity. Surgery may also be used if the doctor isn't able to put your bones back, or blood vessels, nerves, or ligaments have been damaged. Surgery is most common in shoulder dislocations. Gradual rehabilitation is important to help restore your joint's range of motion and strength. It is necessary to maintain the range of motion in your joints because you don't want stiff joints.